After watching the TED Talk about OCD and how it manifests for this one woman in her personal experience, it did confirm some of the things that I already knew about OCD just in talking to people that have the disorder. A lot of what she was saying about things related to symmetry and repetitive behaviors until she felt like it was right or adequate aligns with a lot of the things that I've heard people say who have that disorder. But one thing that was different in Samantha's case was that she felt like it was a good thing, although she did definitely talk about some of her struggles with it and some things that were really hard for her. I think overall she views it as a positive thing in her life because it's allowed her to be really organized and disciplined with things, and obviously it's led her to be very successful. So that was something different that I had never really heard anybody talk about when describing their experience with OCD, just saying that it was positive in any way. So that was another thing that I learned from it, was that some people do view OCD as a positive thing, and also it seems like in her experience she had been very successful just with the therapy instead of medication, which is oftentimes what people think of when they talk about treating OCD. Their first line of defense is medication, especially when it is at the level of severity that Samantha was describing. So I learned that CBT can be really effective for treating severe forms of OCD, and that medication is not always necessary for everybody, especially if that's not something that the client wants. And then leading into the last question, that's something that I would pay attention to in the future in terms of biology and psychology, just how severe the client's symptoms are and how much it impedes their daily functioning. And also if the client views things, as a strength or as something that is really, concerning to them that they really would like to see changed. Because I think in Samantha's case, she viewed a lot of her compulsions as a strength. So that might not always be something that, the client views as something that needs to change immediately. So that would definitely be something. And then culturally, just what is considered normal within that specific client's background. So that's definitely another thing that I would consider when working with clients with OCD.